Good morning, good afternoon, and good evening to our online audience. Welcome to today's webinar, Exploring Lessons on Supporting Children Who've Experienced Violence. My name is Jody van der Heide. I am based in the Justice and Violence Prevention Program at the Institute for Security Studies. I also coordinate the INSPIRE working group, and I will be chairing today's webinar. There are a couple of guidelines for today's event. Please keep your microphones and cameras turned off until we reach the question and answer portion for today's event. The question and answer session will be conducted using both the chat function and the raise hand function in your Zoom application. Should you wish to raise your hand, kindly click on the reactions button to access the raise hand function. Please note that we will evaluate this event using a poll. This evaluation is completely anonymous and helps us to present better events in the future. Kindly do take a moment to complete it, and it will be launched following the presentations portion for today's event. As we wait for the final participants to connect their audio, we kindly remind you to please keep your microphones muted and your cameras turned off until we reach the Q&A section. Kindly note that this is a public event that is being broadcast live on YouTube, so chat and house rules do not apply. This year, the Institute for Security Studies, the International Society for the Prevention of Child Abuse and Neglect, and the INSPIRE Working Group have jointly hosted a series of 7 webinars on INSPIRE, the 7 strategies for ending violence against children. INSPIRE is the leading technical package that is designed to support countries in their efforts to prevent and reduce violence against children. I will be sharing INSPIRE resources and links in the chat throughout the event. We have convened an INSPIRE webinar every month this year, so please feel free to check out the recordings on our website. We will be hosting another one on Wednesday, on the 30th of October, and that will be on life skills and education, so please feel free to join that if you have time. Although the INSPIRE package is a prevention-focused package, it recognizes the importance of evidence-based response and support services for children who have experienced violence. Responding to children who have experienced violence with care is a necessary and important step to mitigate the long-term impact of violence on children's development and to reduce the risk of further violence. These include improving access to good quality health, social welfare, and child protection services. Good response services aim to break the cycle of violence in children's lives and help them better cope and recover with the health and mental health consequences of these experiences. Increasing the proportion of children that receive response and support services requires that effective child-focused services and mechanisms are put in place. The effectiveness of such services require that the relevant protection, safety, social welfare, and other health and other services and providers act on referrals and requests. In addition, there must be government-supported, safe, child-sensitive, well-publicized, yet confidential and accessible to children. But how do these services really work, and what are some of the things that make these services go from good to really great services? We are really grateful to have 2 experts with us today who will share their experiences on implementing such services. They will speak about their experiences, lessons learned, how they overcame challenges and adaptations throughout these experiences. And we are very happy to have 2 case studies from Nepal and Cambodia. We will be together for the next hour and a half, and we really intend for the next 90 minutes to be a conversation, and we encourage engagement from the audience throughout the event, so please pop your questions, reflections, and comments in the chat box as we go along. In terms of how we will structure today's event, each panelist will present for about 10 to 12 minutes, and then I will open up the floor to a wider Q&A session with the audience. So with that, I would like to introduce our first speaker. It is my pleasure to introduce Sarina Sam, who has been working 19 years in international organizations in Cambodia, as well as 9 years teaching in Christian ministries and Bible schools. For 18 years, she has worked with Hagar International in Cambodia in the areas of aftercare program services, institutional and community recovery for the survivors of human trafficking, slavery, and abuse, and supporting supporting program teams to ensure that high quality services are provided to survivors. Her own personal experience with trauma from war, discrimination, and the hardship that comes with deep poverty has deeply affected her outlook on life and has greatly influenced her approach to caring for survivors. Her belief in the fundamental value of love and hope guides how she lives her life, and her joy comes from seeing the broken lives of survivors restored so that they can achieve their dreams, just like how she is doing now. She currently serves as the country director of Hagar, Cambodia. We are very happy and excited to learn about the work that Hagar International is doing on trauma-informed foster care in Cambodia. Serena, when you are ready, please go ahead. The floor is yours. Thank you.
Thank you, Judy. Thank you so much. Let me share the screen. Give me a second, please. Thank you. Good evening from Cambodia. My name is Reina Sam, the country director for Hagar, Cambodia. This is my privilege to be here and share about Hagar practice on caring for traumatized children. And Hagar has been started in Cambodia in 1994, and this year we are celebrating our 30-year milestones. Hagar is working alongside the whole journey of for restoration of the survivor and empower community to prevent exploitation and also strengthening the system to protect those vulnerable to human trafficking, slavery, and abuse. Currently, we are working, we have survivors in our care. They are from the background of sexual exploitation, human trafficking, sex trafficking, labor trafficking, and abuse, domestic violence, child online sexual abuse, and other trauma experiences. So currently we have 208 survivors in our care, and 189 are female, girl and young adult women. So all of our survivors that we work with are caring with trauma. So many of them have severe traumatized that need intensive care. So this is the approach of Hagar's whole journey services that focusing on survivor restoration consisted of the community-based recovery, counseling, health, legal support, that we have our lawyer to assist survivor and their family in a legal proceeding until the conviction. Education and economic empowerment for livelihood sustainability. So the survivors are not just healing for themselves, but they have the opportunity to speak for those who cannot speak for themselves, and or healing, helping to prevent harm in their own community from the issue of trafficking and abuse through joining the survival leadership program. Empower them to be the leader of their community for protection and prevention. So in preventing harm and system strengthening, we engage and build partnership and provide capacity building to local government, duty bearers, children group, youth group, husband group, wife groups, and church leaders that we are working together with them for working together to prevent the community at risk, and also the service provision to the victim or people who are at risk of human trafficking or any abuse in the community. So here's the topic today that I would like to touch base on the community-based care, focusing on a foster care program in Haga. Yeah, and Haga ran 3 different shelters before, since we start in 1994. So we run 3 different shelters, shelter for women, shelter for girls, and shelter for boys. We have been running for 20 years. And at the same time, we're also running the community-based based care. Yeah, but we have been shifting from the shelter care to only focusing on the community-based care in 2015 and 2016 until today. So the survivor care in their biological family, kinship, and foster care in the community-based care, and also the home of love that you see in the pictures here. The home of love is actually the foster care but we name these 2 homes for the home of love that they provide a special care for cross-border survivor victims who were repatriated from other destination country. This is for a temporary placement, 1 or 2 weeks only at the home of love. And Haga started a foster care program in 1997. And currently we have 31 foster families in 6 provinces of Cambodia. And we have 27 child survivors in care of foster families. So those child survivors also including the survivor with disabilities. And why foster care? Why we have foster care in Haga, Cambodia? It's like a home-like approach where the child survivor can easily adapt and connect to the community that is not different from their home community. Yeah, so the children feel accepted and they can learn community life skill, making their own decision or involving around the community and social interaction. It's also a benefit to the whole family while we are working with the child survivor. So it's the family-based approach, and we provide educational awareness to the family and their member on caring and living with traumatized children. And of course, it is cost saving effective. And so through our experience, the children are faster healing trauma and impact to be a positive behavior change while they are living in a community-based recovery. Yeah. And this is how we work on trauma-informed foster care. So we form 4 different types of foster care families. We have emergency foster care who are able to receive survivor at any times, therapeutic foster care who are care for the most difficult cases. For example, child with behavior challenges, child with severe trauma who need intensive care. And traditional foster care who care for less complex child survivor, and respite care that allow our foster family to take a break. Yeah, so we need a good foster family to provide a quality care for our child survivors. So family who have a good reputation in community, referenced by the local government and also church leader if they are from Christian family. So we run through the recruitment process, collaboratively working with the local government. So selected families need to get trained on trauma-informed care, positive parenting, child rights, child protection, safeguarding, trafficking, domestic violence, and other relevant training topics that benefit in care. So existing, during the training, we have the existing foster family will also share their experiences, okay, including like their motivation, challenges, and coping strategy during the training with the newly selected families. So then the family will have a final decision after the training, whether they will decide to continue to become a foster family or not. Yeah. After the hearing all the challenges while caring for the child with traumatized. So the family will have a final decision, and also the involved and agreed by the whole family, their children, their spouse, and their relative to agree on becoming the foster family. So the child survivor will have visited a few foster families or stay a couple of nights before decision making about which family would they feel confident to live with. And this was also agreed by the foster family and the child together. Yeah. And we call this sort of matching placement. To have a child and the family agree that they are agree to stay and to live together. Yeah. And foster care is a temporary placement. So the team is working with the biological family, collaborate with the other relevant stakeholders like local government, NGO partners or consortium in family care first that we are now in the family care first project that we work collaborating with other organizations for to care for the children, and also to prepare for a safe reintegration, because the foster family is a temporary placement. But the long-term family that the child are going to stay with their biological family. That's why the team need to work really closely with the biological families for reintegration preparations. Yeah. So this can be including in the education awareness or training on Cambodian law to the family, child protection, reporting mechanism, good parenting, domestic violence, trauma effect to the family, to be able for them to understand how to provide a good care when after the child is reintegrated back to the families. Yeah, so during the child can have regular follow-up. So while the child is living in the foster family, we reunion, like continue the connection between the child and the family. So they have regular contact with their family, either by phone call or home visit to rebuild the family. Yeah, and this is for transition for reintegration also. So HECA provide also a hotline number for family and child survivor that they can call for help, support if there are any crisis that need intervention. So after reintegration, then regular visit, follow up to ensure that the child is safe until we can close the case. So caring for traumatized children is a big job for our foster families. There's a complex issue dealing with the behavior of the children, and sometimes also having some issue with the neighborhood or at school from the behavior issue of the child. So this need a big heart of the family, big heart of love and care, and also need a lot of patience by not easily giving up on the child. So staff and our foster family do need enough supervision, support, and well-being of the staff and foster family. So at the foster family care reflection, the family can share their experiences, exchange experience, challenging and also coping strategies and planning. So the foster families provide support and motivate each other, and we set up like a peer support within the families to share their experience and also to provide feedback or encouraging each other in terms of caring for the children. And we have learned that working alongside the survivors and families in the whole journey does need collaboration approach. This collaboration with relevant stakeholders and also partner for quality care, strengthen the system, the existing system that are not working well. So working collaboratively with the government and NGOs partner together for fix to have the existing system working and also sustainability. So economic empowerment through vocational training, employment, or business setup would have family income to be able to support their children in education and also daily living. So this is helping to reduce future family separation and unsafe migration. So through the services currently, we have numbers of former survivors who are now become young adults. Former survivors used to live in our foster family. Now they are become young adults, and they willing to come back and help their community. So they join HEGA Survival Leadership Program. They involved in the protection and preventing harm in their community. So they want to give back and speak, advocate for those who are cannot speak for themselves. So this is our lesson learned from what we have been working with the child survivors until they become young adults and they want to give back to their own communities. Thank you so much.
Thank you so much, Rina, for that really excellent presentation. I'm sure there are many questions and comments, but I'm asked if you can hold that for our question and answer session. I really loved how it seems as though you take quite a holistic approach towards the care of the surviving children. And I love that the parents receive positive parenting support, which we know has a really profound impact on the development of the child. So I think that's excellent. Thank you so much. You may stop sharing your screen. Thank you. And I think for now, we will continue our conversation to our next speaker. So it is my pleasure to introduce Sunil Shrestha. Sunil is a legal professional with a specialization in human rights and gender justice. He has more than 14 years of experience working on child's rights and child protection in different national and international NGOs in Nepal. Currently, he is working as the technical lead for protection and safeguarding at World Vision International Nepal. Furthermore, he has been leading the Child Protection Working Group under the Association of International NGOs in Nepal. He loves to go to field visits and interacting with families, children, and community leaders and practitioners, and loves seeing the field reality against the policy measures developed for children. Sunil, over to you. Please go ahead when you are ready. Thank you.
Hi everyone. Namaste. This is Sunil from Nepal. I am working as a technical head for protection and safeguarding in World Vision International Nepal. Uh, yeah. Well, First of all, thank you for this opportunity to share some of the lessons from Nepal while supporting children who have experienced violence. So, World Vision in Nepal has started its journey from 2001. And now we have been working in more than 16 districts in Nepal and more than 55 local governments in Nepal. So just want to give a brief landscape before starting my presentation. So in Nepal, Nepal has gone through the governance reformation back in 2017, and that has resulted the elimination of major child protection structures, and that was really the turnover for most of the agencies in Nepal, having challenges in dealing with the child protection structure. So that is why World Vision in Nepal, we had focused lots of our effort in strengthening the newly introduced child protection structure in all tiers of government. And one of the major gap that we have felt after that restructuring is that we lack the proper incident management platform in Nepal, and that is the point that World Vision Nepal has self-initiated developing its one child incident recording system so that we can properly manage any kind of violence against children for the proper case management process. Just a year back, that government of Nepal has started the formal child protection information management system for the proper case management. And one very progressing part is that the government is now trying their best to fulfill the resource and service gap. So this is the very brief landscape from Nepal in terms of overall child protection scenario. So, World Vision in Nepal, we largely based on system-based approaches, where we mostly focuses on strengthening reporting and referral mechanism in order to deal with any kind of child protection incident and for its proper case management. So our high effort is to have collaborative actions with local governments and also different community groups so that we can have the child protection related policies and strategic action plan in place. And also we do the compulsory vulnerability assessment in our working locations so that the children in vulnerable situations and most vulnerable children are identified on time, and so that we can also take the preventive measures on time. And one major legislative provisions that we have in Nepal is the provision of child fund, from where the children who have experienced violence are supposed to get support from the government through the child fund. So our larger effort has been focused in establishing child fund and also building capacity of the stakeholders. And we have been regularly interacting with all the child protection actors and also service providers so that whenever we have any child protection incident came into our knowledge, then our actors and also service provider can take quick action. So besides the system-based approach that World Vision in Nepal, that we focuses on community-based approach, focusing on socio-ecological approaches. So where we focuses on building capacity of children and also local child protection groups and also government stakeholders. So these are largely based on preventive approach. However, from our learning in terms of supporting children who are abused are mostly lack the awareness and also their capacity gap. So that is why we are highly focusing on building capacity of the children. And one of our minimum child protection requirement is also engaging children and adolescents in life skill and also life skill packages. So this is one of our core learning and also best practices in Nepal. And then community level awareness is one very important part from preventive as well as from response part, where we largely focuses on changing the harmful social norms and practices. So and one another important part is advocacy part, where our most of the learning is that whenever we deal with any child protection incident and its case management, that we often get higher level of political pressures and also the inability of the government officials to deal with that. So that is why one of the important part that we have been doing is advocacy part, and World Vision has one of the core project model, child protection and advocacy project model, that we we are implementing throughout our area programs. So, how we have been working with our stakeholders for dealing with any kind of incident and also supporting survivor's child is partnership approach is one, where we ensure that the proper case management processes and proper service mechanism are in place through policy mechanism, and also those policy measures are being well disseminated to at community level. So that is one approach that we have been working with the stakeholder, and the advocacy and influencing part that I have already mentioned earlier. So one important part that we have been focusing is resource commitment. So without resource, our greatest learning is that the quality service delivery is often compromised by resource commitment, and that is not only in terms of budget but also in terms of provision of structures, in terms of policy measures, and sometimes in terms of government initiative to uh, let people know about the existing services. So that is one important part, and another is monitoring part. So it's not only the monitoring that what government is doing, but it's a holistic approach that what all the child protection actors have been doing and what is the scenario of child protection situation in the particular location. So that is one important part, and the collaborative actions, that is most important in child protection sector, because isolated approaches is often the failing approach that happens in child incident issues. So that is also one of our greatest learning in Nepal, because whenever there are any child protection incident happen, it's not only that the particular sector of agency will be able to deal with the situation. There are multiple agencies from different sectors has to be engaged in the process. For instance, mental health and psychosocial support is something different from giving a shelter for the survivor child. So we work with collaborative approaches to deal with the issues. And as I mentioned earlier, so capacity building is one very important part. And for Nepal, that one of the challenges and also learning is that we still have uh, having problem with the scarcity of the availability of the service providers and also the resources that they have. So capacity building is one of the important part that we have been focusing in Nepal. So how World Vision that we do support to survivor child is, we are not the direct service provider in Nepal. We go through reporting and referral mechanism so that we can ensure the immediate support for the survivor child. That can be from mental health and psychosocial support, any kind of legal assistance, or any kind of survival need that the survivor child along with his or her family may need. So we ensure that, and as a basic component, that World Vision also ensure those immediate support need in our program as well. And another is case management process, where holistic case management processes are ensured through the collaborative actions with the stakeholders uh, that can go throughout recovery, rehabilitation, and reintegrations, and definitely the collaborative actions that I have already mentioned. And one important part in regard to collaborative actions is linking survivor child with the social protection scheme. Basically, we need the full accountability from the government mechanism for that. But again, that is quite a challenging part in Nepal, that we don't have much social protection mechanism for the survivor child. Even whenever there are worst case scenario that we identified during any kind of incident, at that time we mostly feel the lack of child protection scheme for the survivors. So that are the most important thing. And the bridging support that basically we ensure through referral mechanisms, and that has so many aspects that encompasses throughout. One of the example is sexual and reproductive health related support. So there are incidents when we have identified cases where the survivor child, basically the girls, are identified with 7-8 months of pregnancy, mostly in rape cases. So at that time, these SRHR related services and support are most important. So we bridge that support through different health institutions and also SRSR related specialized agencies. So this is the platform that before government of Nepal has introduced CPIMS, Child Protection Information Management System. So World Vision itself has developed this live platform. This is internet system where the data privacy is highly ensured, and we regularly monitor all these data and also manage all the cases and we have the comprehensive data desegregation process so that we can monitor that how many cases has to be closed and how many has to be follow up. So this is one of the example that we have experienced, and also we have learned so that our learning is well replicated in the existing CPIMS system that has been rolled out by government of Nepal. So these are some of the testimonies that has been come out from field. So mostly from capacity building, that children and both parents, they really feel confident whenever they have any risk associated with the situation. So this is the testimony that we brought from the field. And I just want to share some very basic result that we were able to produce is that all the working locations wherever World Vision is working, that we have been ensuring that 100% of the local government are ensuring that they have proper incident reporting and referral systems. So that is how we have been collaborating with the government. So having all those best practices and learning in place. But again, our most challenges and also learning is that child protection cases are always underreported, and so it is up to us, up to the actors, that how we can identify the incident and the cases. And CP services are often lacking, mostly in the countries like developing countries in Nepal. So that is why our advocacy based approaches are very helpful. And the sociocultural barriers and including political barriers are the greatest hinder for dealing with child incidents. So that is all from Nepal, and I'm happy to respond any queries. Thank you.
Thank you so much, Sunil, for that excellent presentation. I'm sure there are many questions, and I really love how you have that really data-driven case management system that I think a lot of people would find useful. And I'm sure it took a lot of work to develop that system. So thank you so much to our two speakers. I now want to open up the floor to our audience. Please pop any questions, comments, reflections in the chat. You are also more than welcome to raise your hand, and then you can unmute. And if you want to switch your camera on as well and ask your question, please introduce yourself and the organization that you are from. We have about 50 to 40 minutes for the session, so hopefully we can have some excellent discussions. So please raise your hand if you have any questions or comments, or how this affects your work, or do you see similar things in your day-to-day work as we have heard in these presentations? So please feel free. I think I will kick us off with some questions. Shayna, I really liked your presentation, and I have a question for something that you mentioned. You mentioned that Hagar has an empowerment and leadership program, and that sounds like there's some capacity building in there as well. Could you maybe speak a little bit more about what that program involves?
Thank
Thanks.
you, Judith. So did you mean for the survival leadership program?
Yes.
Oh, yeah. Okay. So this program is we started this program from the survivor alumni. So Hagar, we have been serving for more than 5,000 individual survivor within these 30 years in Cambodia. So we still having have connection with the former survivors. So we started the alumni from last year. So through that alumni, we start to have the group of the survival leadership who are voted by their alumni to be the leader of speaking on behalf of their voice. So now currently we have two groups of the survival leadership, and we have 11 survival leaders who joined in the groups. So the purpose of sharing their story and also advocate for the protection and prevention in community. So we also would like to see the survival leaders are having their voice in the government meeting that's involved in the community level, district level, provincial level, and also the national level to provide input into the government strategies and planning. So also survivor, the leader, they can share in the prevention activities in the community on safe migration, human trafficking, or child sexual abuse or exploitation, also sharing child protection during the campaign. So they have been trained. We have to be trained them on those types of topics, related topic that they can be capacitized and also share and raising awareness. And we also would like to have them sharing. So far, we have some survivor leaders who have been also share their story or advocate at other country, not just in the country. So yeah, that is how that we work on the survival leader. Also, they are providing a really good feedback to the HEGAS program. Any new project or any project evaluation or research, then they will provide us the input. For example, next week we are celebrating HEGA anniversary in Cambodia. That will be participate in the government at the national level, subnational level, and also donors and stakeholders, and who have been working with HEGA for these 30 years. Former survivor, they come, former staff to celebrate these 30 years. So this also organized by the survival leadership. Not just HEGA alone. So work together, and survival lead, they will lead all the session, most of the session in the program. So this is kind of example they will share their voice and input while the government will be there too. Yeah.
Excellent. Thank you so much, Shaina. And it sounds as though, I mean, especially if it's alumni, I'm sure that also helps with their healing and their recovery process as being able to give back and help other survivors as well. I see a question in the chat for you as well, Shreina. This is from Aneska. She is a student at the University of Pretoria, and she has a question for you. If the parents are the cause of the child's trauma, why are both parties allowed to contact each other? Would that not hinder the healing process of the child?
Thank you for your question. Very good question. Yeah, so there's two different kind of the families of biological family at risk. The family who are involved in child abuse or trafficking, that they need to come through the court or the legal proceeding. But while the child are living in the foster family, they miss their family, of course. And we start having reintegration preparation since the start of the placement, since we intake the new cases into our foster care program. So that's why we are working with the family, collaborate with the local authorities at the families where they are living, and also other stakeholders, NGO, provide awareness raising, education to the family, and law. So our lawyer provide a Cambodian law on domestic violence or any trafficking, any abuse, so the conflict to the law. And so through the assessment, we need to be ensured that the family is safe before reintegration. So we are not going to reintegrate the child while the family is not ready. And so that's why we keeping the child and the family connection is a kind of a transition and preparation. If we are not going to have the child alone to visit the family. So we having like a staff accompany the survivor. If there's so risk at the family, the child may not stay overnight, but if you come back with our staff, the child. If the family is safe, then overseas by the local authorities and other stakeholders, and the family need to have like a contract really with to have ensure that the child are safe while living, staying with them for a couple of nights during the visit, for example. So the kind of testing along the ways, and so also after the integration, that with a really regular follow up and working with the local authority. So that's why we have the hotline number or crisis number 24-hour that the child can call anytime, or the neighbor can call, or the family can call for intervention. Yeah, the Heka Virana hotline also. So
Thank you.
for our practice, not all of the children are able to reintegrate home. So there are some child survivor, they stay in the foster family until they now become young adult living independent, but still not able to reintegrate it back to their family because of the risk concern. Yeah.
Thank you very much, Reina, for that detailed response. I hope that answers your question, Aneska. I know David had a hand up. Do you still have your question? You are more than welcome to go ahead.
Oh, yes, yes, yes. I just want to find out from the presenters, how long does a child stay with a foster family? And do they get support for the child in terms of schooling, clothes, food, to ensure that the family is not burdened with anything like that? And of course, I assume that there will be sessions of counseling and supervising of the families to ensure that everything is fine.
Very good
Thank you.
question. You. Sunil, I know your presentation focused on the referral response services, but do you have any experience of that in World Vision? And then we'll go on to Shayna's answer as well.
Yes. Thank you, David, for that very important question. The duration of the child survivor, their stay in foster care depends on the nature of the incident and the cases. So, for instance, if the cases where the children are victim by their one family members, at that time, the duration of stay in foster care or in safe house will go beyond more than a year or several years, and even sometimes that they have to stay more than even have to be stay at foster care for a long time. And even sometimes the care plan that goes beyond the completion of their childhood. And even we have some of the foster care that we have also experience of referring the cases on to those foster care, that even the children has to stay for a long time. And but again, in Nepal, that we have policy mandate that the foster care, they are the last resort for any kind of alternative care. Mostly our policy mandate is for the kinship care or any other alternative care. So that depends on the nature of the cases. And for services, that yes, we have the policy mandate that these foster care has to ensure the compliances like the basic education, health facilities, counseling, and also not only that, if the children are not interested in formal education, then the foster care has to link children who has completed the age of the appropriate age for the vocational training and education. So those facilities has to be ensured by the foster care based on the policy compliances. So that is the practices in Nepal. Thank you.
Thank you, Sunil. Shayna, any comments?
Yeah, I think for Cambodia, quite similar for how long that the children living in foster care through HEGA. I think from each organization they have different guidelines or policy, but for HEGA we have, because this is temporary placement, so for 2 years. However, we are working case by case depending on the need of the child. So some children may need less than 1 year or 2 years, or other may need more than 2 years if they are not still reintegrated to their community. And so for supporting the children, actually foster family recruited foster family, they are not HEGA staff, they are volunteer and they are partner with HEGA. So we don't have any salary for them. We have a very small stipend, but for the daily living of food, clothes, hygiene, and any basic need and food for the survivor, that's HEGA will support through the foster family. And counseling, actually, because we are running the community-based recoveries, counselor and case managers are assigned to work individually with the survivor and the family. So, for their healing process.
Thank you very much for those responses. Any other questions or comments? I think I saw another hand somewhere. Please feel free to raise your hand or pop your question in the chat, and you will see that our evaluation poll has just popped up. It's completely anonymous and helps us to create better events in the future. It will take you 1 minute to fill out, so please do that if you are able to. We would really appreciate it. I have a question for you, Sinhil. You spoke about working closely with healthcare services and working with government, and that would require a lot of coordination with other stakeholders. And in South Africa, we are beginning to recognize how important working with having a multi-sectoral approach is, especially with preventing and reducing violence. What was it like? What was the experience of coordinating with government? Is it something that you've developed relationships over a long period of time? Because it is quite a time-consuming and long-term process. So any experiences in doing that?
Yes, thank you, Jody, for this question. Yes, definitely, it's time-taking and very patient task to do. For World Vision, that we have our programming approach developed in a way that we balance the system-based approach along with the community approaches, so that we can bridge the community people with the duty bearers. So for that, we have step-by-step processes, and also we have those programming guidelines as well. So one important part is that we do not work in isolation from the government agencies. So that is one of the foremost important part. And another is one of the core compliances for us is to strengthen reporting and referral mechanism is to have resource and service mapping in place, so that we can identify all the actors and also available services in our particular working location. So that will be very helpful for us, that whom to contact, when to contact, and sometimes based on the nature of the incident, that how can we get those information. So that is one aspect of identifying the actors and services. And another is the staffing structure, human resource staffing structures, that we need to plan in a way that we have ample of opportunities and time to have interaction with those actors, so that otherwise whenever there are incidents and we don't know any actors and we go for seeking support, that will be quite difficult and challenging for us to get the services for children on time. So rapport build up is definitely time consuming, is definitely, but again, that is all for the children. So we do that processes through that resource and service mapping.
Thank you so much, Sunil. We have the same experience in South Africa. We find that it really is quite a long-term process with building relationships, but it's definitely worth it when we see the results of it. It's definitely with it as well. Any other questions? I saw someone unmute themselves. Please raise your hand if you have a question. But I do see another question in the chat from Moise. I'm not sure who this is directed to. Are there any mechanisms in place to keep the foster families in check? That's a good question. Studies on serial killers suggest that many of the serial killers were abused by their own families and went to live with foster families by child services and ended up being abused by them as well. I do think that the example of serial killers is an extreme example, but I understand what you are asking here. Are there any mechanisms in place to keep foster families in check? Shrina, any comments on that?
Thank you for your question. I would like to share from Cambodia. So yes, in Cambodia, we have the guideline or the guideline from the government on foster care that we call alternative care, the national guideline from the Ministry of Social Affairs. So for all the foster family, Hagar is they recognized by the local government, the Department of Social Affairs. So while the child is put into the foster family, yes, Hagar staff go and work with them regularly, follow up. And we work with the local authority, the Department of Social Affairs in the community to also follow up and working with the family. And so both family, foster care, and the child have the hotline, right? They understand the reporting mechanism that they can call anytime if there any abuse or happen in the foster family. So we have report feedback, also counselor or social worker who working directly with the family and with the child. So if there any crisis or incident happen, that need 24-hour reporting and taking intervention. Yeah.
Please remember to keep your microphones muted unless you have a question. Thank you so much, Shrina, for your response. Sunil, any thoughts on that from your perspective in Nepal?
Yes, well, for Nepal, that we have many issues that are linked with foster care families, and that is why government of Nepal has made a very strict standards, not only for foster care but also having the regular monitoring of those foster cares. So we have the examples when some of the foster cares, their registrations have been denied, their registrations has been cancelled because of based on the monitoring and their ability to meet these standards. Sometimes there are the incident when even the safety and security of children in foster cares are questioned because of lack not able to meet the standards. So yes, we have very strict mechanism to monitor the foster care. However, there are some of the challenges that even government foster care mechanisms are also being questioned based on the quality and also their ability to accommodate the children. For instance, the foster care having capacity of accommodating 20 children are forcefully, like have to accommodate more than 50 children because the availability of services are low and the need is high. So that though there are incidents, but again, the government are very strictly monitoring the situation. But regarding the serial killer, that we don't have any incident and example till date in Nepal. So thank you.
Thanks, Sunil. David, I see your hand. Please go ahead. There we go.
Hello, were you saying me
Yes,
or another person?
no, you go ahead, David, with your question.
Oh, okay. I'm just curious to know from the presenters. I had a case whereby the mother of a 11-year-old child sent the kid to sleep in the toilet outside, and the mother is so angry against the child. I don't know why. And she told the child, why don't you go to the highway so that the trucks can just hit you and die? And the child went to the granny, and then the grandmother, okay, accommodated the child. But after some time, she complained that, no, this child is stealing, this child is like this. Our family is now having a problem. And we involved the social workers, but suddenly the police came in also, and the poor child is being, into, what do you call it, hard situations, whereby he is not needed, and at school he is not performing at all. And I've seen children who don't perform. The domestic violence in the family does affect their learning at school, and they become bullies and always angry. Thanks. I wonder if how would the presenters handles such a situation.
Thank you, David, for sharing that story. Does any one of our panelists have a comment? Perhaps you have experience with a similar situation. Shrina, any thoughts? Any reflections?
Thank you for the sharing the case study and the scenario, the child in the family. So, if that case happened in Cambodia, in the family, and also especially in the foster family who are not biological family. So after receiving the report, anyone that report to the hotline or report to us, then we will start having the investigate immediately. Investigate. So we have a separate staff or with the local government to work with the child, and also we have a separate people to work with, investigate the family and other relevant people in the family or community. So there will be investigation process, and also the child need to be immediately taken from the family. Even though we don't know whether what's happening true or not, but we have to withdraw the child for the safety first, and they have to investigate later. Yeah. Yeah. That's the process. And then if that involved with like legal or law in the country, that need to go through the proceeding, a legal proceeding. Yeah.
Correct. Thank you very much, Shrina. Any other questions or comments? If not, I think I will use my powers as chair to end our session a little bit earlier. I know our panelists are joining from where it is evening and after work hours where they are joining from. So I don't want to make you work much later. But if there are any other questions, maybe we do a last one or two and then we can bring the event to an end. If not, I do want to say thank you very much to our panelists for taking the time to join and share your very important work that you are doing. The recording of this webinar will be available after this event. Please feel free to share it with your networks. Please be on the lookout for future webinars. And thank you again very much for taking the time out of your day to join us and for sharing your excellent work. Thank you so much to our online audience as well. Thank you very much, everyone, and have a lovely day further.